Hey everyone, welcome. It's Alex Barker, founder of the Happy Farm D, and with me today I have Martijn Bijker. He is the founder of From Science to Pharma, and he and I have known each other. We kind of crossed paths, I don't know, the last few years, but we finally put a time on the calendar to talk, and we have gone back and forth a little bit about his company, my company, what we do, what he does, and he helps people from all over the world, not just in pharmacy, but in all medical or science professions, help people make that transition from science to pharma. So hopefully I haven't butchered the work that you do in my own description, but Martijn, thanks for hanging out with us. I appreciate it.
Thank you for having me, Alex.
So kind of give us like the high level overview, the bird's eye view of your career, where you started and how you got to where you are today.
I can do that. So I originally started as a scientist, chemistry, did my PhD in the Netherlands. In between, I also went to the US for a 9-month internship in San Diego. Did my postdoc in Australia for 3.5 years. Really did not like it. I can almost say I hated it. So I was happy to leave. I came across the MSL role. Someone said, maybe that's a good role for you. You like talking to people, you like talking about science, because I love the science, but I didn't like doing the experiments anymore. So being in a lab doing the experiments is not the best place if you don't like doing experiments. I wanted other people to do my experiments, and so that didn't work out. I left my research career, moved into an MSL role at Abbott in Sydney. That turned into AbbVie because they split. Then I moved into an MSL role in Amgen in immuno-oncology. So my background is in immuno-oncology, so how the immune system rejects cancer. From that one, I started my MBA, and I started my side business, the From Science to Pharma, as a small training company I had. I moved into Merck Serono, into marketing, and then back to medical, and now I'm a medical director at Theramex at the moment. So in between, I also started my company. Happy to talk a bit more about it later. But this is my career as from science to pharma, or in like 10, 12 years time spent.
So from what inspired you to create this company? Because the entrepreneurial bug is pretty rare when it comes to nerdy types like us, when it comes in the science field. You wouldn't think that you would have gone this route. So what led you to this point?
I was I moved from science to pharma, so I moved into my MSL role myself. I really enjoyed it. And people ask me, how did you manage to get into this role? Because every single job advertisement asks you to have 2 years experience. So how can you be experienced and not having had the job and getting the job? So I said, I think it's just being really well prepared, knowing everything you should know. And that 2 years is just to kind of cut the boys from the men, make sure that you only get the good ones. But I think if you prepare really well, you can get in. So that's how I got in my MSL role. And everybody asked me, so how did you do that? So I started to help them, having a coffee, a chat, a lunch, a phone, probably the same thing you started, and helping them out on what I did, what helped for me. And when I was in my second MSL role at Amgen, I was 1 year in my MBA and I had a back surgery. I was out for 7 weeks, and maybe as nerdy types, the brain never stops. So I might be physically incapable of walking, but I wasn't incapable of thinking. So my brain was thinking. 1 year in my MBA, I thought, maybe I can make a business out of this training. I've been helping people for free. I can make a training out of this. So that's what I did. It was December at my surgery, 7 weeks into January, started building IDs. Everybody thought I was crazy, and it probably was. I was crazy, but I never listened. I listened, but I never. I just do what I want to do anyway. So I listen and take their advice, and that's it. So then I moved. In April, I started my company. Started training person one-on-one, then one on the Skype, then three or four people face-to-face at my place where I did my MBA, and then people wanted to dial in from different states, from different countries. So I did webinars, paid webinars, and from that I made it. I thought I can't do every 4 weeks, 3-4 hours a webinar. It's too many planning across 3 time zones. It was Europe, US, Australia, And with summer, winter time, things start to move around quite a bit. And we're doing a 3-4 hours webinar. It's kind of tricky, in 4 time zones, 3-4 time zones. So then I built everything online. So that was kind of how it started and how it evolved over time.
So quick clarifying question.
Yeah.
One of our Happy PharmD coaches, actually we have a couple that are in pharma, and one of them identified 40 different job types, and that's probably not even including all of them, of the different things just pharmacists can do. So when you say from science to pharma, what role specifically are you helping your clients mainly focus on?
Yeah, it's a good one. So my vision was future-proof. So I wanted to do from science to pharma, thinking everything from science to pharma. I started with the MSL role, so I'll come to that later. But the vision is and still is to do multiple roles. I thought I would start doing it earlier. I thought I'd do the MSL role, done, tick, do the next one, senior CRA, sales, MedInfo, pharmacovigilance, drug safety. Kind of got stuck at the MSL role. One, because I've done the role, I know it, and I'm good at it. And two, I realized there's so much to do there. So I probably should have called it from science to MSL, but my vision and still is that it can be a lot bigger. We're actually now expanding in what we're doing now with the MSL role, with the training. But that was the initial thought. What we're doing now is really from science to pharma as an MSL. So the medical science liaison, the MSL that requires your scientific subject matter expert. So that's why you often have, especially in the US and Canada, people with a terminal D degree, PhD, a PharmD, or an MD. And I think pharmacists roughly are 40% of the MSLs have a PharmD background. And you have to be a subject matter expert to come into this role as a medical science liaison, because you liaise with the key opinion leaders, the top clinicians in the field, on anything that's related to a certain disease, a certain drug, a certain therapeutic area, we call it. So that's the focus of our company, medical science liaison, and we have been expanding that. And hopefully in the next few years, maybe next 5 years, we're going to do other things. So far, it's just MSL.
Thanks for clarifying. There is a lot to do as an MSL, as I've learned from people getting into those kinds of roles. One of the things that I'm always interested in, especially from your perspective, I don't believe in the idea that everyone in a profession should have a certain disposition, shouldn't have the same kind of personality, skills, or abilities, but you see over and over again patterns, right? Pharmacists typically were detailed-oriented people. I am not. I'm one of the few that is not very good with details. But have you seen certain traits that you see over and over again happening for MSLs? And I would be particularly interested if it's true for both, MDs, PhDs, and PharmDs. So just kind of an overview question of the kinds of people that get into the MSL role.
You often see these are extroverted people, because you have to be, so you're often on your own. So depending on the country, you could be quite far away from head office. So, I mean, think about the US, Canada, head office might be in New Jersey or New York, and you might be in Texas. So having contact with your colleagues is not there. So you have to be there on your own. You go out to see doctors, and you have to talk to them. You have to engage in conversation, discussions. If you don't like talking to people, if you're an introverted person, it's going to be hard. You might like working from home then, and before you go to the doctor, but you have to reach out to the doctor via phone, email, talk to them maybe 30 minutes, an hour. You go to conferences, you have to walk up to a doctor, strike up a conversation, go to this doctor, having a chat, having dinner meetings. If you don't like talking to people, it's going to be a hard job. And I've seen people that were not really comfortable in that role. They were promoted from one role to another, thinking it was a great role, but they were struggling. So I think overarching, you see that people like to work with people. They're extroverted, or at least can convert to an extroverted personality. I've seen it as well. Like working with people, like talking, like discussing science, and all the other things are extra. But I think if you don't have that personality to like working with people, then you have, it's a struggle.
What would you say is a good first step for someone who is in science, is thinking about pharma, but maybe you know, is looking at jobs, maybe even apply to a few places.
Yeah.
What would be a good way for that person to validate that this is actually the career path that they would want to follow?
Yeah, great question. So funny that you ask. We actually made recently an MSL career suitability test. So are you suitable for an MSL role? So it's kind of funny. I don't know how it started, but it's a 15 question survey. You answer questions. Do you like this or you don't like this? And you get points. And I think you have to score. If you score more than 60%, you could be MSL potential, and more than 80%, you definitely should be thinking about a career as an MSL. And if you're like 90% or 100%, the MSL career is for you. So all the things, all the traits that we have seen and come across that would be very valuable for an MSL, or you think you should like as an MSL, we put it in a kind of 15 question survey, score that, and you get a score out of it. And it's just a quick one. Is it something for me to explore or not? And that's a quick test, 2-3 minutes. So what I'll do, I'll send you the link. So you maybe put it in the comments, or you can
Smart.
send it to them.
Yeah.
Because it's
Yes.
really, how do you know? And we in the past, and we still have free webinars. The webinar's a bit longer, so it takes you a bit more time. But if you want to have a quick screen, is this something for me? You just answer these questions and you have a quick answer, and then you can explore. Okay, what is it more? What more does it take to become an MSL? And we have resources, white papers on our website. We have free webinars where you can ask questions to learn more. Is it really what I like? But I think the first asset test would be a quick MSL career suitability test, and that's what kind of we developed. Was it a few months ago actually, and pretty interesting.
Very cool. You've been doing this now for how many years? You said 3, 4.
2015 I started. So 2014 I had my surgery. 2015 it started, and 2016 we made it online, fully online.
Okay, so a little over 5 years. That's great.
Yeah, and still growing. So I can't complain.
What, and this is something I think I'm curious about, but I know people listening will be as well. You can never really predict where someone will go when you work with them in the capacity like you and I do. And one thing that I always enjoy talking about are the outliers, the people that you thought, man, they were this, they were in this situation, and they went through our program, and now they're doing comedy, now they're doing video game design, now they're doing coding, now they're doing this or this. And those are fun stories to talk about because it goes against odds or expectations. I wondered if you have like a standout story of ideally a pharmacist, or just anyone really, a PhD or MD, of someone in their situation that has gone from this to now doing this.
No, I don't. I must say, everybody who's done an MSL, so everybody we trained becoming an MSL, they love the role. They say, I never want to go back. They're so keen on the role that they say, this is what I actually was looking for my whole life, and I didn't know it existed, and I love it. It's crazy. They pay me heaps of money for a job that sounds really easy to me as a person, probably because they're good at it or they like it. And they say, I can't imagine to pay me this amount of money for a job that I love doing every day, talking about science to doctors and traveling. And so they actually don't want to leave. So I've never seen anyone become a comedian afterwards, or
well, no, I sorry, I don't mean to confuse it, because I don't want you to think. I know that you're not doing that, and we typically don't either. 95% of our clients typically stay within pharmacy.
Yes.
But sometimes they go against all odds, or they go against expectations of what they went into. If you have a story like that, that'd be awesome to share. But if not, I think my question next would be about trajectory of where these people go after that. Because what I find, I'd be interested to see if you see the same thing, but when a person goes from typically a job maybe they don't like, or at the very least they're just like, it's their zone of competence, but they're not like excelling in that place, and they get into a job they love, they all of a sudden have this like renewed passion to really give their career the energy it deserves.
Hmm.
Do you have a trajectory or a path that a lot of people follow beyond the MSL role, or do many people just stay in that role and they're fulfilled by that?
Yeah, so it depends a bit per country. In the US, you see that it's often we call it the cul-de-sac. You get in and you kind of stay in
Mm.
because it's such a big country. You have territories. Unless you're close to head office, it's hard to move up the ladder. So you could be an MSL, maybe a senior MSL, an executive MSL. Maybe you become a field medical director. So that's like an MSL manager managing a whole team. Like in research as well, you have your PhD postdoc professor. So you kind of stay there. The idea is that you can move up, and that depends a bit per, like I said, per country. In Europe or Australia, when the country is a bit smaller, you're closer to head office. You can more easily engage with head office. There are more senior roles there. You have medical advisor roles you could have, so which is more strategic role. You can then become associate medical director, medical director. So there's a clear trajectory upwards. But you have to move to head office. If you're far away, I mean, maybe now after COVID, people are more open to remote working. But before COVID, it was you have to be close to head office in order to walk that ladder. People, you see them moving sometimes in more commercial roles, so marketing roles, a little bit. I've done it myself, and I moved back to medical. Health economics, market access, so pricing and negotiating about prices with health authorities. That's an often a trajectory after an MSL role. Most people like the MSL role. So you see a lot of people staying there, especially in the US for 10, 15, 20 years. In Australia, Europe, you see people move quickly from a few years MSL to senior MSL to medical advisor, senior medical advisor, and where they have a team of MSLs reporting to them, and where they're the lead to a launch lead, where they're responsible for leading the launch of a drug to the market, and working with the internal stakeholders. So it becomes from less visit less in the field, more in the office, less technical, more strategical.
So I think my final question would be about keeping your eyes wide open.
Mm-hmm.
One thing that we make sure, in our program is we never want someone to walk into a job with rose-colored glasses, as they say, and think
Mm-hmm.
this is going to be amazing, this is a dream. So I think one of the obvious, what I want to talk about are just some of the negatives that people need to be aware of,
Mm-hmm.
and you mentioned one of them, which is travel. If you
Yeah.
don't want to travel at all, then becoming
No.
an MSL outside of COVID-19,
Yeah. True.
we exist, in a world where that travel is a requirement.
Yeah.
So, besides traveling, though, what are some of the other things that people kind of struggle with in the role of an
Yeah.
MSL?
Yeah. So a lot of people they love the job. Once they start the job, they kind of love it. It is actually what they miss in research because they like talking about science. They like interacting with people, reading, discussing. And as a scientist, you can't do it. As a pharmacist, you do a lot of discussion with your patient, but it could be very like simple discussions. You might want to have a bit of higher level discussion with clinicians, top clinicians, professors. So that high level discussion is often not in the role in pharmacy or as a scientist. In an MSL role, you see that it flourished. A lot of these discussions going deeper into the topic. So a lot of people say, "Wow, this is a fresh breath there. I love it. I can dig myself deep in the content and start talking about it." So most people have little reservations or little negatives when they start. They know, I mean, if they've done the test, they've done the course, for instance, our course or talk to people, they know there will be travel involved. But it depends, right? If you're in the southern part of the US, you might have 5 states you travel. If you're in New York, it might be enough hospitals you can do by subway or by train or by car. You might just have little travel other than just day travel rather than overnight flying. So depending on the country and the state and the territory you have, the travel could be minimal or maybe a bit more. A lot of people, I mean, if you go from, I'm not sure, pharmacists, what they get paid, I've been hearing now they're getting paid per hour, $25 an hour and only a few hours a week, 25 hours a week. Salaries are not great. If you go to an MSL role, a starting salary is $130,000 US dollars a year, plus bonus, plus super, plus medical, dental. So you increase your salary massive. So a lot of people like that. It is a full-on job. So I have heard people saying, "Whoa, I didn't know it was this full on. And so it was like, there was a bit of a, I mean, they pay you a lot. They want the best and the smartest people. So they expect you to do well and work hard. Oftentimes it's not like you have to work weekends. And I mean, sometimes you have conferences, but companies are often okay with time in lieu or getting a half a day back here. So it's pretty good. So negativity, not so much, other than like, well, it's full on. It's, you need to know the disease, the doctors, the internal stakeholders, how drug works. There's so many things to learn. So that's like, whoa, that's a lot. My negative thing was always doing my receipts. Because you travel, you have a lot of receipts and you have to put on all the receipts. So that was my only negative about, and in the past it was a white sheet of paper, putting all
they have software for that now.
yeah. I'm a bit older. I when I started a few years ago, probably 10 years ago, it was an A4 with your receipts with a glue stick. You put them on, you put them in. And now it's like you get your receipt, you have your iPhone, you click on it, it's in the system. You still have to process. It's a lot less worry than having a stack of pay. I had always like a Ziploc bag with my stack of receipts, and then when you're back in the office, you have to put them back, scan them in. So that was my only negative thing. Talking to MSLs, they kind of like to travel because it's on your own. You can meet up with friends interstate. They pay for your dinner, maybe a wine or two if you're lucky. You're free, you can read. It could be a bit lonely. So that's one thing maybe sometimes if people feel, because you're constantly traveling and you're on your own, you should be a confident person being able to kind of deal with that loneliness. So what you see that MSLs, they're like talking, they're on the phone with their MSL colleagues, with their friends, with their wife, more MSL colleagues. So they're constantly on the phone to kind of compensate for sometimes the lack of interaction, physical interaction, seeing people, because you go to a doctor, but it takes you a few hours to get there via car or train or plane. So that is sometimes the downside of it, that you are traveling on your own. Maybe COVID makes it easier. You don't have to travel. You do this whole kind of Zoom meeting. That I think definitely will change the MSL landscape. But I haven't seen a lot of negatives, to be honest, other than just travel on your own and receipts.
And obviously all those things need to fit the right person. One thing you don't want to do when you hear all these things is convince yourself that you can change for a job. You know, if you're not doing these things already outside of it, it's difficult to change who you are just to fit a role. That I would not recommend. Martijn, thanks. One thing
to add in terms of the travel, I was when I started my MSL role, I was reluctant to do. So I think my manager said there was not that much travel involved, and I think I'm glad he didn't say there was too much travel involved. There was actually more involved than he said it was. That's why I did get a job, and I love the job. So having started the job, the travel didn't mind so much because the job was so great. So,
and that's important to note. Yeah. Martijn, thank you for sharing with us your story, where you come from, how you, where you are at now, and a little bit more about the MSL role. If people want to find out more, where should they go to?
They should go to www.fromsciencetopharma.com.
Awesome. Easy to remember. All right. Thanks, Martijn.
Thank you very much.